everyone, and welcome once again to the Healthy Living Podcast. I'm your host, Gina Haran. We have got a great one today. I'm here with Dr. Nitza Alvarez. Good morning and welcome.
Good morning. Thank you. Thank you for having me.
So you are the founder of the Tri-County Heart Institute, which serves the villages and Leesburg and surrounding areas. You're also online at Nitza MD, where you go around and you talk about women's heart health, cardiovascular health. That is your passion, which we love, and we'll talk about that some more. You're also the author of Heels versus Ties, where you talk about women-specific heart health. So again, welcome, and I'm so looking forward to talking to you today.
Thank you. Thank you for having me here today.
So you went to med school, you did your residency, and then all of a sudden, did you just say, you know what, my passion is going to be women's heart health? Take us through how you got inspired and how it started.
Well, after I went through med school and I decided that I was going to become a specialist in adult medicine, cardiology was a passion for me because when it comes to matters of the heart, patients are in a very vulnerable situation because heart means life. And I wanted to be that specialist that is at bedside with the knowledge to help them, but also to be able to reassure them that everything was going to be okay. But it wasn't until I started in my training in cardiology that I realized that too many women were dying for a condition that is preventable 80% of the time, and that many of them didn't present the same way that a man presents. So is there when I started going into getting more interested in understanding why was that happening and what do we know about women heart disease, and realize that everything that we know about heart disease is in men. So like, for example, when I talked about, you mentioned my book, Heels versus Ties, and my male patients come to me and said, and when are you going to write a book about us? And I go, everything is written. All the books that we know is all about you. Because in medicine, there's studies been done in men, so we clearly understand heart disease as a man condition, but we are lagging behind decades of information and data treatment in women. So that's where my passion started for it. And after I finished my fellowship, came down to Florida, established in Florida to serve the community, then even more so, already practicing in cardiology, seeing patients dying, women, mothers, sisters, friends, because when we talk about heart disease and we said, so many women die each year, and the statistic says that about 420,000 women die each year from heart disease, a condition that is preventable 80% of the time. So we're burying about 300,000 plus women every year that we could have saved. And when we talk about numbers, it sounds just numbers, but when I'm at bedside, this is somebody's mother, this is somebody's wife, this is somebody's sister. And then it started upsetting me. And what can we do? What is so hard to be able to prevent this disease? And then that's how Nitza MD came into place. Nitza MD is a preventive program that is run under the business of Tri-County Heart. Tri-County Heart Institute is a company that provides cardiology care. Nitza MD is inside Tri-County Heart as a preventive program, trying to help women understand the risk, help women be proactive in their seeking medical care, and also helping women to understand what can they do before the disease has developed to help them, save them from being at the hospital, and help the mothers and the sisters, because statistics are statistics, but when it comes to personal matter is your mother, is your sister, is your wife. So that's how all of this started. Now, once I'm there and I realized that there is so much lack of information, not for lack of scientific information, granted. It wasn't until 2016 that the American Heart Association finally released a statement saying that it is clear that heart disease in women have been diagnosed, undertreated. Women are not treated properly. They're being neglected when they're seeking medical care. The risk factors are not identified. We're not doing a good job. That was just in 2016, which is just 8 years ago. And we said, wow, this is an institution that is dedicated to care for Americans with heart problems. And it just recently came out that, oh, it's a reality. Our women are not getting treated properly. And although that's sad to know that it was just the other day that came out, it's actually hopeful that at least we started talking about this condition, and we started talking about the differences that exist in women and men, and what are our risk factors are different, and the treatment. But the women don't know that. So in the scientific world, we understand a little better, although we still need much more information. But at least today we understand a little better that our hearts are different, that the mechanism of heart disease in women are different, that our risks are different. But our women in our community don't know that. So that when I come. So I call myself a communicator because I said, well, the science is there, but who knows it? So then that's when the advocacy come. And my passion is to educate women and educate women in my community, and hopefully one day to the world. That's the reason why I wrote the book Heels versus Ties, because I said we need to give this information to every woman. They need to know what to seek for. Why are we different, so they can become their own advocates? Because if they are in front of a provider that don't recognize their condition, they can still advocate for themselves.
That is wonderful and great information. I've got some facts from your book, some great information, and some very interesting information. Heart disease is the leading cause of death in the United States, causing more than 420,000 of people that don't make it. That is the population of Miami. I looked it up. It's true. That is shocking. 50,000 more women than men die of heart disease every year, and they're totally different. More women than men die because we are underdiagnosed, and we're going to get into that a little bit later, but that's something, when you watch TV, for example, you never really see, oh, the woman died of heart disease. It's always the man, the dramatic, oh, I'm having a heart attack, and then that's what happens, and you think, oh, well, I guess, it doesn't occur to me that I'm ever going to be that person. Or, as you mentioned in your book, women are mostly treated for things like hormones or reproductive system, but not the heart. So that is fantastic that you're addressing this. And then each year, more women die from heart disease than all cancers combined. And all we ever do really is focus on cancer. And as tragic and sad as that is, this is an unknown, treatable, preventable disease. So we'll get into that in a second. So heels versus ties. Let's talk about why men and women's heart situations are different.
Well, now we started to understand that it's actually a different condition. It wasn't until the other day when the statement was released in 2016 that it was believed that heart disease in women and men were the same thing. We're extrapolating research. So in medicine, it's all about our research. And so the studies have been done in men for decades, is now centuries. And it was not done intentionally like that. It was not that it was intended to exclude women and not study them. Mm-hmm. At some point, there was a good intention to protect women of reproductive age. They were going to be trying drugs, and they were afraid that they can harm the fetus. And then one of the major issues for us to be included in the studies was that they felt that the hormones were going to skew the results. So it's better to just don't include this population because we cannot control hormones. No? So,
right, okay.
So if we cannot control the hormones, then how can we control what the results are going to be? And believing that the hormones were going to create an impact on their results that they will not understand. So they exclude us from a lot of those research. But even as of today, there's the majority of the individuals that get studied is still men. So what we know about heart disease, we study in men. What we know about treatment for heart disease, we study in men, and then it was extrapolated believing that we were just little men. That's why I said, one of my statements is like, women are not little men. And we had Dr. Nina Goldberg, that she was one of the pioneers that started kind of like talking about this awareness that we are different. And she said, women are not small men. because it's not like because it applies here, it applies there. And now we understand that the disease perhaps is a completely different disease. It's not necessarily the disease that manifests in men, because even though women can develop disease similar to what a man do, with blockages in the arteries and heart failing to pump, the majority of the time a woman will present with heart problems, and then when they do studies, they don't find what's wrong because we're using tools to identify the disease that it was designed to identify disease in man. So that actually is the reason why there's still such a disparity. And then the second part in the reason why we're burying so many women is because when they are going to seek medical attention, the providers that are seeing them are not aware of our differences, so they're being neglected to the point that they stop talking about their symptoms because they feel that they're crazy now. No, so now it's in my head. No, if you are expressing that you don't feel good, and this is actually now we're going forward to you already have a problem, no? And because it's not so easy to identify what your problem is because I'm not familiar with it. If I'm not a provider that is unfamiliar with your condition and how the heart disease presents in women, you can come to me, but your eyes cannot see what your brain don't know. If I put an apple in front of you and you don't know what an apple look like, it doesn't matter that I have it in front of you. You're not gonna know that that's an apple. It's just something that I'm holding in my hand. So if a woman presents with, I'm short of breath to the emergency room or having an indigestion, but the physician that is attending her does not know that shortness of breath can be the only symptom that that woman might have before she dies because she's having symptoms of a heart attack, then they won't see it, so your brain cannot see it. So now we're trying to understand and help, as we help physicians to understand that our disease is different, and then also helping our women to understand that they have to continue seeking medical attention until they get an answer.
Well, thank you. We're going to take a quick break. We'll be right back with Dr. Nitza Alvarez here on the Healthy Living Podcast. Don't go anywhere.
Is pain or restricted range of motion keeping you on the sidelines? Get back in the game with expert orthopedic care from UF Health Medical Group Orthopedics. UF Health Medical Group Orthopedics provides robotic-assisted surgical joint repairs and replacements, post-operative care, and inpatient rehabilitation services, all close to home, right here in Lake and Sumter counties. And for those unexpected injuries, UF Health Medical Group Orthopedics offers convenient walk-in and same-day appointments. To learn more or to schedule an appointment with one of their specialists, call 352-323-5665.
Welcome back, everyone, to the Healthy Living Podcast. I'm Gina Horan here with Dr. Nitza Alvarez. Okay, Dr. Alvarez, I am legitimately in the wheelhouse of needing to go see you. So over 55, check. Let's see, postmenopausal, yeah, and also overweight. Now, I did take the test, and a few of those things I was fine. No stress, no hypertension. I exercise, but what could I expect when I come to your offices for what, say, a stress test?
Okay, so first of all, we are hoping that every woman, just like you did, kind of like goes through the checklist and said, I'm at risk for heart disease, rather than waiting until we have a problem to come, no? So basically what we're trying to do is, can we help you stay healthy? No, can we help you prevent the heart attack? But once a woman goes through that checklist and said, check, yes, I have family history, yes, my dad have high cholesterol, yes, I smoke or I live a sedentary life.
And also family history also plays a part.
Family history plays a part, that is correct. So there are, the Framingham score is the one that we utilize to evaluate any individual that might, for the risk of heart disease. But for women, there are some certain peculiarities that is not necessarily included in that score that has to do with menopause, stress. Like you mentioned stress, and I'm very happy that you have zero stress. So
I really do. I'm so lucky because honestly, I'm pretty chill person.
I'm so
but yeah, I know a lot
that must be your personality.
Maybe, I hope so.
So once you go through that checklist, and then for women, important to understand that menopause plays a significant role in your risk for heart disease. Actually, that's when the risk basically align with men's risk.
Okay.
Men's, for the most part, in general, their risks start earlier. For women, it's a little later at the age of 55 or postmenopausal because the hormones play a role in protective for our heart. So, although of course there's no age for heart disease, but at least when we look into age as a risk factor for heart disease, a woman that is older than 55 is a woman that is going to be a higher risk for heart disease than a woman that is younger. But when you come for an evaluation, we're going to have you, after we assess your risk, and then we had to run some tests. And that's what I said, well, you don't know until you know. And the reason why I say that is because you can be feeling good, you feel great. We have athletes, we have patients that are super active, and they feel okay. There's not a problem. And then, but how do you know that you're not developing a problem? And that's why I love to use the analogy of the car.
Yes, let's do that. That is awesome.
So, and then I'm going to take you back to what is it that we're going to do in the office. So I said, when you are, you take your vehicle for maintenance, and we have to take our car for maintenance because we want to make sure that when we get in that car that we're not going to have an accident, that the brakes are going to work, that we have oil, that everything is working well with the car to ensure your safety when you go out. So, but when it comes to our bodies, we don't go for regular maintenance. We wait until the car is like smoking. It will be the equivalent of there's smoke coming out of the hood and you're like, oh my God, what just happened? And then that's when you go to the doctor. That will be the analogy, like, I don't feel good, and that's when you go and see the doctor. So our goal is that, can you take your car for maintenance? Can you take your amazing body, which you only get one, and can you go and get checked? And then, and during that check, the idea is to identify if there is anything right now that can potentially become a problem, that if we address it today, we will avoid the event. So if you go and get your car checked and the guy tells you, oh, your tires are, you need new tires, then you will say, okay, so let me get the new tires before something bad happened to me. So the same when you come to the office, it's like, we'll check your cholesterol. We do blood work, look at markers in your blood that might increase your risk for heart disease. We run some tests that are to understand how is the blood flowing into your heart, how does the structure of your heart look like, and then another battery of tests that once we put them together and put it in I see it as a puzzle. No, we put all the pieces in the puzzle, then we can see your overall picture of your cardiovascular health, and from there move and said, this is what I identified. How can we work on that? There's many things that we can do just with lifestyle, but because we're detecting them early. If you say, when you take your car for a checkup and they said you need oil, so then you detect it earlier. Now they don't say, oh my God, you ran out of oil a long time ago, and now you had to change this, and that. And now instead of being a $50 check, now is a $5,000 or $1,000 because you already broke other parts of the car because you were not taking care of it.
And that goes along with prevention. So,
that is correct. Yeah. That is correct. That goes along with prevention because we do it. We don't wait until it's broken to repair it. So that's what somebody should expect when they come to seeking for preventive care in our company is, this is what we're going to be doing an evaluation, and then we'll sit down and then help you change what is modifiable so we can help you continue living a healthy life. And if there is something that can potentially become a problem, how can we steer the boat so you don't end up hitting the iceberg? No? But now it's also important to understand that the majority of the insurances are not pro-prevention. No, so I changed it.
I'm sorry, it's terrible because wouldn't the costs go down? I mean, it seems, like, oh, not so many people are coming in, we can manage our costs, and yet it's not. So
that is correct. Yeah, so it's actually when I do my talks, I said this is not a healthcare, it's a sick care insurance. No, the insurance is going to be your card when you're sick to seek attention and at least get some of that cover if you're lucky enough that they cover, because even when you're sick, you might not even get covered. So insurances are not for pro-prevention. So you gotta invest in yourself. And if you see health as a form of wealth, then you will be willing to invest in yourself. And that's when I love the analogy of the car. And I use it because I think it's the easiest way to present to you why are we okay going to go for maintenance of the vehicle, and when you go and you need to change tires or you need to put new brakes, you don't present your Geico card to pay for that because you know they don't take, Geico is not going to cover that. You're going to need to pay. That's your investment to keep that car good. And the same with gas. I said, when you go and put gas, you don't go to the teller and then said, oh, here's my Allstate card. They're like, oh no, we don't take insurance. You got to pay cash. So you got to be willing to invest in your health, and do not let a health insurance that doesn't cover preventive care be the reason why you're going to wait until you're crashing to know. So it's valuable to think about an investment on you. If you can invest in a car, which you can have many of them, but you only have one body, why are you not willing to invest on that body? And then take it for a good checkup, and then that way you can help that. You might be able to use that body for many decades to come rather than just another 5 years.
Well, that's a great place to take a break. When we come back, more with Dr. Nitza Alvarez here on the Healthy Living Podcast. Don't go anywhere.
Are you looking for a bank with heart? For over 85 years, United Southern Bank has served businesses and families in Central Florida with excellent customer service and the latest in banking technology and products. USB offers free checking, high-yield savings accounts, residential and commercial loans, and much more. Whatever you're looking for, USB delivers on personalized service and friendly, fast communication. Stop into one of our 12 convenient locations or visit us online at unitedsouthernbank.com. United Southern Bank. We are united in community. Equal housing lender and member FDIC.
Welcome back, everyone, to the Healthy Living Podcast. I'm Gina Horan, back with Dr. Nitza Alvarez. This was so interesting when I read in the book Heels versus Ties. Marriage reduces heart disease risk in men, and yet it increases heart disease in women. I mean, first of all, okay, I get it because hello, but can you please explain that to me? Because that just seems so normal. Like, of course it's that way.
You know, when I started talking about that, it was funny because I said, it's not a joke, it's true. This is actually being published, scientific papers, this is data. It's about the stress. You know, stress definitely plays a significant role in cardiovascular disease in women. And because of that, marriage for a woman mostly normally represent more stress because now we have children that we have to take care of, and is a husband that we are there for them. And then on top of that, we also have our parents, and then so marriage is more work for us, no? Even though for a man, it might be the equivalent, but for them, it's mostly normally is more relaxing because then now they have a support system at home that makes them feel a little more relaxed in that aspect. So stress level is the reason why marriage is actually increases our risk for heart disease versus men that are a little more relaxed after they get married. Well, the truth is that we're amazing. What can I tell you?
Well, I mean, we do it all, and I'm neither married nor do I have children, so maybe that's part of the reason I'm not really that stressed. But I do know that I've been taking care of my mom lately because she's getting a little bit older, and all of a sudden, for the first time really in my life, I started to feel, oh my gosh, like, is she okay? What am I gonna do? So I can't even imagine when you get married and you start to have kids, you have so many people relying on you, and then when you're a working mom, and then when you're a doctor, you've got all those people relying on you. So next question obviously is then how do you manage your stress? I know that you practice what you preach because obviously look at you, you're gorgeous. So talk to me about how you, again, practice what you preach and really live what you're trying to, share and your passion with other women.
So I take my health as a priority because health is a form of wealth. And if I need to look at everything that I have, I'm like, this is actually my major form of wealth. And I also do it for my patients. I feel that it's important that when I'm sitting down to talk to my patients about the importance of lifestyle, exercise, diet, and management of stress, that I'm actually doing that. And then not only because it's an example, but also because I can offer them tools because I'm doing it. So then when we talk about weight loss or what is it so difficult. So then I share what have worked for me. But I take my mental health as a priority, and that has always been like that. I had to find myself in a place where I said, oh my God, I cannot live like this. When I wake up, go to work, go to the hospital, go to the office, come back, go to sleep, repeat. And then when I saw myself there and I said, I don't want to live like this. And that was about probably 10 years ago. And it's when I started spending more time. But what I do is I wake up early. So that is the only way to do it. No, so for me, that's the way to do it. No, so whenever I talk about incorporating time to meditate, that's gonna be my morning. When do I create? It's gonna be my mornings. So I wake up at 4 o'clock, have my cup of coffee or tea, mostly coffee. It's like a ritual, calm down.
Your alone time.
It's my alone time. Everybody's sleeping. And then I actually have a good book that I'm reading, and then I read a few pages, do my meditation, and then I rarely exercise in the morning because I go after work to exercise. But if I do, then I will do it, then wake up the kids, get them, prepare them breakfast. Not that they need it, but I love it because it fills my mom tank. Because it's all about balance. It's all about how can you don't have to be 100% here, 100% there, 100% there all the time. But when you're there, be 100%. So for my kids, it's those mornings because they see me before I go to work and before they go to school. Mm-hmm. And so I'm like, how can I be present? So if I have 30 minutes, so that's 30 minutes of filling my mom tank. And then it's like preparing a little bit of coffee or their breakfast, and then I go to work. So, and then in my diet, I always want to make sure that I'm very conscious about what I'm eating. We all eat a little bit of everything. I have my guilty pleasures, but it's just about moderation and be mindful that, if I want to have a healthy life, then I have to invest on it and I have to be willing to do it.
Well, and I can see that it pays off and you're gorgeous and inspirational for sure. What would you say to women who think, oh, I can't, she's, women like her, or they're so, disciplined, and look, I can never even get there. I'm at this point in my life very overweight, very sad, or whatever. How do you encourage them to just dip their toe in to get started?
So I always said that the first thing is to be mindful that human nature is always an all or none mentality. Like we think, it's like trying to eat the elephant in one bite. And then we said, okay, let's start with one thing at a time. And that's what I always say. Sometimes when we identify that there is so many things that we need to do to help you get where you want to be, it's daunting and overwhelming mentally. But then if you said, listen, you're doing nothing right now. Can you get out and do 15 minutes? Can you walk for 15 minutes for me? And then you start with that. And it's all about starting. It's like trying to get out of bed in the morning and you're so tired and you're like, oh, but once you're out, you're out. Right. So the same thing is with activity. The same thing is with your diet. So I said, let's start with little steps. So if you're doing nothing, let's go out for a 15-minute walk. The idea is that if you can do a minimum of 30 minutes, 5 days a week, which is 150 minutes the American Heart Association recommend, that's number one, is start slow, do minimal things. Like when we talk about modification of diet, after we go over the testing and we do labs and we identify that there are a few things that you can change. Let's say I identify that you can cut down on cookies and your bread, but also you need to cut down on dairies. And sometimes it's interesting because I have patients that come with their wives, couples, and then either the spouse says, so no cookies, no cheese, no this, and I go, wait a second, one thing at a time. Let's cut on the cheese first, then we'll talk about the cookies. Because then it can become very daunting. So I always say, take it one at a time. Do one thing for you today. Even if it is getting up and making your bed, then that's one thing that you're doing for you today. But when it comes to changes in lifestyle, it has to be small and it has to be consistent so you can actually make it your lifestyle. So that's actually what I would do, what I recommend for me, for my kids, for my friends, and for my patients as well.
Well, one thing I read in your book that has been kind of controversial lately is the whole precept of women loving their bodies no matter what. Self-love, no matter how heavy I am, no matter what I weigh, I love myself at this size and so forth. And you explain that, of course, you should love yourself, and of course, all of that. But also, I think you said, if you don't take care of yourself, you're truly not loving yourself. Can you explain that a little bit for us?
I think that had two connotations. No, I said, well, you know how many times we don't put ourselves as a priority, and you mentioned earlier, now you're taking care of your mother, and then there's many women that are taking care of everybody else but themselves, and they love their children, so they will skip everything that has to do with themselves to be there for everybody else. And my point is that you're not loving yourself. So you can accept yourself the way you are. But in order to love yourself, you gotta be mindful of how is it that I'm taking care of this temple, which is my body. And yes, okay, I don't have to be skinny to be healthy, but am I doing the things that I need to do to be able to stay healthy and present? So that's one thing. I don't need you to weigh 130 pounds. But are you doing what you need to do to take care of your body? Because that's how you show your love. It's not just like, this is me. It's like, okay, so this is me, and you don't move, and you know that all these risk factors are there for you, so what are you doing for them? And then the other one is about loving yourself. Like I posted in one of my social medias a few months ago, and I said, mothers are willing to die for their children, but are they willing to live for them? Because you gotta take care of yourself. You gotta love yourself. And it's intrinsic in us. We are there for everybody, and it's hard for us because it feels selfish. Like now taking care of yourself feels selfish. But if you think about loving yourself will be loving your husband, because then you'll be present for him. Feel stronger for him. And I know that any husband will put their wife as their priority. They will be like, go get checked. Go and get that thing that you need. It's us, it's on us. So if we think that taking care of ourselves, if we actually come to an agreement that as we take care of ourselves, we are loving our kids, that as we take care of ourselves, we are loving our husbands, that as we take care of ourselves, we're loving our spouses, our friends, our community, then you start with you, and then you're healthy, and then you just go from there.
Well, and I mean, it's always the old adage, putting on the oxygen mask first, and then helping your kids. They don't say that for no reason. Like, honestly, quite frankly, we do have to take care of ourselves, because otherwise, like you said, when the sister and the mother and the daughter runs out of time, how are they going to help anybody, when they're in that situation?
Absolutely. And do you think that, if we had to think about a family that, would your children prefer for you to invest a day and X amount of money on you taking care of yourself, or do they rather spend that money on a funeral for you?
Well, there it is. So I'm pretty sure they want the mom and sister and grandma around. Dr. Nitza, are you working on anything in the future?
Absolutely. This is a never-ending project. So as I mentioned to you earlier, the initiative of Riding Heels versus Ties was the beginning of what we're trying to do to empower our women to take ownership of their health and be their own health advocate. So we're working on our second book, and that is going to be coming on later in 2025. But coming soon is a documentary that we've been working on, which is a docuseries, also with the intention. Now we're going to be presenting some of our patients with testimonials. We're talking about the same issue. Why are we different? How are we different? Continue to create this awareness. So I will invite people to look out for that docu-series. It's going to be super fun to watch, super educative. And I think that more important is just to give you more power to become your own advocate and make sure that you don't become a statistic. So stay tuned. A lot of good things happening, and I'm excited.
Well, Dr. Nitza, can I call you Dr. Nitza?
Absolutely.
You're so much fun to talk to. Thank you so much for joining us today. Now, where can we go on the socials, or how can our listeners and readers get your book, Heels versus Ties?
Well, you can find the book on Amazon, and it's available in Audible form, so in case that you want to listen to it while you're driving to work. It's also in the paperback form. And you can find me on social media at NitzaMD on Instagram or Facebook. And my page, nitzamd.com, that's where you can actually do the test that we included in this book, so you can do your own assessment and see if you will be a good candidate to come and visit us for a preventive program.
Well, I took the quiz, and I'm ready to come see you anytime, Dr. Nitza. Thank you so much for joining us. And that's another episode of the Healthy Living Podcast. I'm Gina Horan. Join us next time.